joined with Public Health Madison-Dane County. The mayor and I are going to make a couple of remarks. Be available to answer questions. Today we were notified by the Centers for Disease Control and the State Department of Health that the 12th confirmed case of the novel coronavirus in the United States is an individual here in Dane County. Public Health Madison and Dane County will share what it can about this case after some comments from the mayor and I. Dane County and the City of Madison share a combined public health department. Over the past couple of weeks, as awareness of and the number of cases of the virus have grown, city and county teams have been working to prepare in the event the coronavirus made its way here. Preparedness for these types of situations takes many forms. Last week, for example, new questions were added to the protocols used by the Dane County 911 Center to screen those calling for an ambulance because of breathing problems. These questions are intended to give emergency responders better information before entering the homes of sick individuals, information that can help them prepare. Dane County Emergency Management has shared guidance with EMS responders countywide about the best ways to protect themselves, being mindful of gloves, masks, and cleaners they should be using on calls for personal protection. We have communicated guidance to all county employees of ways they can stay healthy. Public Health has been busy coordinating city, county, and state resources, making sure we were ready in the event this virus presented here. Given what we have seen in other parts of the globe, it's reasonable to assume today's news will not be the last positive case we hear about in our region. In advance of this, Public Health is in the process of creating a new coronavirus hotline to keep the public informed of the latest guidance involving this virus. Public Health will be posting regular updates on the hotline, the webpage, and social media. The overall risk we face is very low. We are at a much greater risk of getting influenza, but the same things that help us reduce the risk of influenza also reduce the risk of coronavirus. The news could change a lot over the next several days and weeks. Sometimes it may change several times a day. Together, we will respond as we do with any challenge. We will coordinate our efforts, keep the public informed, support each other, look out for one another, and care for our friends and neighbors. I'm going to hand it over to Mayor Rhodes Conway now, and then all of us will be available for questions. Thank you.
Thank you, County Executive, and thank you all for being here. I'm Satya Rhodes Conway, the Mayor of Madison, and I just want to reiterate a few things that the County Executive said and maybe add a few more details. So earlier today, the Wisconsin Department of Health Services announced that we do have a person with the novel coronavirus here in Dane County. That patient was traveling from China and went immediately from the airport to the UW hospital and clinics. They were tested for coronavirus and have been isolated at home since then. They are doing well. They are still in isolation at home and will remain there until testing shows that they no longer have the coronavirus. And I want to emphasize this. Today, in Dane County, a person's chances of getting sick from this novel coronavirus remains very low. We are ready for this. Our public health staff plan and train and practice for novel viruses like this, and they are prepared. For the past month, we have been preparing for a confirmed case of the novel coronavirus with our state and local healthcare providers, and we will continue to work closely with them to monitor and respond to this situation. The city and the county have taken a number of steps to be prepared. In addition to what the county executive talked about, we initiated an incident command structure within public health on January 22nd to organize and coordinate our response to this virus. And that means that there are more than 50 people who are actively involved, training, and ready to respond. The county executive and I get daily updates on information about what's going on in the county and what preparations are underway. Our public health department stays in regular contact with healthcare providers, and they give updates and information as the county executive said, to first responders and our emergency management partners. The Public Health Department is attending all of the Centers for Disease Control national calls and webinars to make sure that we are up to date on the latest information, and they are sharing information in our business community with school districts and with higher education institutions across Dane County. We are updating the Public Health Madison-Dane County website and social media pages daily, sometimes more than daily, with information not just about what's happening here in Dane County, but what's happening statewide and across the country as necessary. And our staff continue to respond to questions from the public. I want to re-emphasize that we do have a hotline for updates on the novel coronavirus, and that number is 608-243-0587. Again, the hotline for updates on the novel coronavirus is 608-243-0587. I'd like to close by saying that I call on everyone in Madison and Dane County to be aware, particularly in this time, of unconscious or implicit bias. The Centers for Disease Control and Prevention do not recommend isolation, quarantine, or testing of people who have been, who are of a particular ethnicity or have been traveling in particular regions but are not necessarily symptomatic or have not been screened at the airport. You cannot tell if someone has a risk of spreading the novel coronavirus by what they look like. This public health concern will not be solved with fear and discrimination. We will fight it with compassion and with science. I'm going to remind you that we have our Director of Public Health Madison-Dane County, Janelle Heinrich, here, and Amanda Kita Yarbrough, who is an epidemiologist with Public Health Madison and Dane County, along with myself and the county executive, and we'd be happy to take questions.
What more details about the person? Are they an age, male, female? Are they trying for business reasons or personal reasons?
We can state that this is an adult who recently returned from travel in China. Other than that, we're not providing any additional information to protect the individual's confidentiality.
Usually, at least the gender is provided. That's pretty general.
Yeah, we're not providing that
How would
today.
that identify somebody?
That's just the decision that we've made to help support
just seems
confidentiality.
Why are we obsessed with gender?
Can you tell us if
'Cause
they're
it's a lot
connected to UW-Madison at all? We do have a lot of parents and students who are worried about that. Can you tell us if they are connected in any way possible?
We are not identifying any of the contacts other than if people are perceived to be at risk or meet the screening criteria, we will be in touch with them. We were not linking to any in other institutions.
The county executive said that this would likely not be the only case. How so? And why do you think that?
I think we need to realize that we have an emerging health condition that we're all monitoring globally and locally. So I think we'd be remiss to think that this is the only case that we might ever have, and that could be something that could happen at any point in time.
Mayor, you said that travel by this individual, the individual went directly from an airport to UW Hospital and then to aftercare. But in terms of the airport, had the individual been screened prior to arriving in Madison at another airport location, or?
The individual arrived prior to screening criteria that were placed for by the federal government.
What do we know about if this, well, when this person was on an airplane, what are the risks to people who might have been around them?
The risk remains low. We are in contact with the CDC to identify what that process might be. I will say that this individual, we could consider the gold star of people who may have had meet the screening criteria. They've done everything right, and including wearing a mask and reporting directly to the ED upon arrival.
You said that they're staying inside their home. Is Dane County making sure of, or taking any steps to make sure that they're remaining
Linda, do you want to come over? Sure, we can answer that
Should
question. I'll
introduce
ask
yourself,
Amanda. Yes.
Hi, I'm Amanda Keita Yarbrough, epidemiologist with Public Health Madison and Dane County. We are in touch with this person every day, making sure that they're staying home. We ask them if they need any supplies, and if they do, then we work to provide those supplies.
And if you go over again which airport they came in from, and did they connect to any other airports again? I don't know who to direct that question to.
We're not releasing that information right now. It's a constantly emerging situation where we're gathering information hourly.
Now that there is,
You won't say if they arrived at Dane County Airport or O'Hare or Milwaukee?
I don't know the answer to that. No.
now that there is a screening protocol in place at some major airports, is there any need in Dane County to do any level of surveillance or screening, or is the screening taking place at the larger hubs sufficient?
So they are screening people for symptoms at the larger hubs, and then they're also collecting contact information from everyone. And people who have no symptoms will be allowed to continue on to their final destination, which could be Dane County or anywhere in Wisconsin. And then that contact information will be shared with the local health departments. And then we will contact that person to determine exactly where and when they traveled and if they have symptoms. And the CDC is recommending various steps based on their answers to those questions.
Does this person live with anyone else, and are those people isolated to their home, or are they free to come there?
We are not going to be discussing the contacts of this individual to protect their confidentiality and their health information.
Have the other passengers that were on the planes with them been notified so they can be tested?
That's in process, identifying the flights and identifying the contacts, and then they'll be notified by their various local health departments. But testing would only be recommended if they had any symptoms.
Just for the record, can you say where in Dane County? Is it Madison, not Madison?
We're not going to be disclosing that.
Can you go over what it means by recovery? Does that mean the patient is no longer shedding the virus, meaning they're no longer contagious? I know there's some words that are out there nationally, or like as far as a lot of the cases that are overseas. So can you describe what it might mean when a patient's recovered or when they're no longer symptomatic?
We're still working with the CDC. There have only been 12 cases here in the U.S., so I think everyone's still learning. But we'll be monitoring this person regularly, both by phone, by lab, and make a determination about when they're no longer infectious, and then can be, go about their daily lives.
Can you describe what the symptoms were that led the person to go directly to the emergency room?
No, that was personal health information.
What day did this happen? Today?
So we were notified today that we have a positive case.
And when did the person go to the hospital?
Late last week.
Do you know which day it was?
I don't remember exactly.
I believe it was the 30th.
And when did they come in? When did they fly in? That third day?
They arrived and immediately went to the ED.
Any other questions?
I just want to clarify again the airport. I thought the mayor said arrived in Madison and went to the hospital.
I believe they did arrive in Madison and then went on.
They flew into Madison directly.
I do not know their full travel manifest to be able to disclose that right now.
But they went from the Dane County Airport to the hospital.
That is what we understand right now.
I'm sorry, could you two spell your names?
Heinrich, Janelle, Janel, last name Heinrich.
Amanda, Amanda, Keita Yarbrough, KITA-YARBRO.
Thanks, everybody.
Thank you.
Thank you.